Welcome to Asiaverse, where we explore key issues shaping Asia's future. Today, two distinguished experts will discuss antimicrobial resistance, or AMR, in Asia. Mr. Dennis Erpelding, a senior advisor with Public Policy Asia Advisors, a leader in international animal health, and a member of the International Poultry Council, and Dr. Pushpanathan Sundram, CEO of Public Policy Asia Advisors and an expert in public policy and regional governance. On September 26, 2024, global leaders met at the United Nations high-level meeting on AMR to confront this growing crisis. The meeting emphasized the devastating potential of AMR, predicting that without coordinated global action, it could result in 10 million deaths annually by 2050 and incur a staggering economic loss of 100 trillion. Asia, which accounts for 40% of global antibiotic consumption, is at the epicenter of the AMR crisis. Countries like India, China, and Indonesia are experiencing rising rates of antibiotic overuse in both healthcare and agriculture. Today, we'll discuss how AMR affects human health, how agriculture plays a role, and what ASEAN and Asian governments are doing and need to do. We'll also explore the role of international cooperation in addressing AMR. To start, Dennis, can you share what the September 26th UN high-level meeting on AMR revealed about the impact of AMR on human health, especially in Asia?
At the UN high-level meeting, there is a major emphasis on the human health toll of AMR. It's a major focus when we think about the One Health concept, which is a more holistic approach to considering human, animal, as well as environmental impact. A recent report that came out during the UN high-level meeting on eco-AMR noted that by 2050, if no action is taken, human healthcare costs due to antimicrobial resistance could rise $159 billion per year globally. Further, without action, AMR in humans could cause 38.5 million deaths between 2025 and 2050. As we think specific about Asia, and we think about the human health burden, it's expected to be the heaviest in lower and middle income countries, such as in South Asia, with estimates of 630,000 annual deaths. This is particularly in concern if you think about countries like India or China, if we think about drug-resistant infections for newborns in India, or multi-drug resistance tuberculosis in China and India. It's critical why we take a One Health approach as we think about the human health impact of antimicrobial resistance.
So, Nathan, how does the overuse and misuse of antibiotics contribute to the worsening AMR crisis in Asia?
In many parts of Asia, antibiotics are overprescribed due to several factors. In countries like China, studies show that 57% of patients with upper respiratory infections, which are often viral, are prescribed antibiotics even though antibiotics don't work against viruses. This type of misuse is fueled by the pressure on doctors from patients who expect quick fixes and by a lack of diagnostics to identify bacterial infections accurately. The issue is compounded by the over-the-counter sales of antibiotics in some countries like Indonesia, where antibiotics can be purchased without a prescription. Studies suggest that up to 70% of antibiotics in some parts of Asia are sold without proper medical oversight, making it incredibly difficult to control misuse.
Alright, so Nathan, we're seeing overuse in healthcare, but what about the infrastructure challenges in these healthcare systems that make AMR worse?
The infrastructure challenges are enormous. For example, many rural and underfunded hospitals across India and Bangladesh have limited diagnostics tools. This means antibiotics are often prescribed as a precaution, even when unnecessary. Hospitals also struggle with poor infection prevention measures, leading to the spread of drug-resistant bacteria within hospital settings. A survey in India found that 30% of ICU patients have acquired hospital infections caused by multi-drug resistant bacteria. Improving hospital hygiene and investing in rapid diagnostic tools are essential to tackling this problem.
Let's now turn our attention to the role of agriculture in AMR. How does antibiotic use in animal farming in Asia contribute to the spread of drug-resistant bacteria?
In Asia, there's some estimates that 80% antibiotics are used in agriculture, particularly in China, India, and Vietnam. The uses include for therapeutic purposes, treatment, control, or prevention, as well as the growth motion. I think we all need to recognize that whenever an antibiotic is used, in food animal agriculture, there's a risk of resistance development. Thus, we need to ensure that any antimicrobial is used properly. We've heard recent stories in the past years of colistin resistance, MRSA, and things like that, and those are a risk from a public health standpoint. So we need to take a holistic approach in animal agriculture, human health, as well as the environment, ensure all antibiotics are used appropriately, because inappropriate use can lead to spread of resistant pathogens or resistance genes that are potentially causing adverse human health effects. So we need to make sure we're responsible. From an agricultural standpoint, very importantly, we need to be very concerned about the foodborne pathogens, of which are examples Salmonella and Campylobacter. Also, obviously, if there's a direct worker exposure to an animal, we need to be concerned there as we think about resistance and human transfer from animals to humans.
Right. Then, Dennis, are there any efforts underway in the region to regulate the use of antibiotics in farming?
So think about regulations in the region. Over the last decade, we've seen dramatic improvements in countries as Thailand and Vietnam and others on ensuring they're actually regulating these antibiotics. As we think about laws and regulations, there's been more laws and regulations put in place relative to doing a risk analysis in the regulatory approval process, stricter controls on their distribution and use, stricter controls on their on-farm use, having more veterinarians involved in that processes. Further, another important step is actually around enforcement of practices. So countries are stepping up their enforcement to ensure all antimicrobials are used properly. So whether we think about Thailand, Vietnam, or India, over the last decade, we've seen dramatic improvements in the regulations of antibiotics in food animal production.
Let's move on to discuss what ASEAN and Asian governments can do to combat AMR. Nathan, what are the key steps that governments should prioritize?
ASEAN governments must take urgent, coordinated action to tackle AMR. First, regulations across the region need to be harmonized. Currently, countries like Thailand and Vietnam have stricter controls, while others such as Cambodia and Laos lag behind in enforcement. This creates loopholes where drug-resistant bacteria can spread between countries through travel and trade. Second, governments need to invest in national surveillance systems. Some progress has been made. For example, Vietnam has developed a national AMR surveillance program that tracks antibiotics resistance in hospitals and agriculture sectors. However, most countries are still struggling to collect and share data effectively. ASEAN could play a central role in creating a regional surveillance network to monitor resistant patterns across borders.
And what role should individual governments play in regulating antibiotics and educating the public, Nathan?
Governments should focus on three core areas. 1. Regulation. Governments in India and Indonesia need stricter enforcement of existing laws that limit the sale of antibiotics without a prescription. Regulations of antibiotic use in agriculture needs to be constantly updated as science advances and to mitigate any significant risk. 2. Investment in healthcare systems. Governments must invest in healthcare infrastructure, especially rural areas, to improve hospital diagnostic capabilities and infection prevention measures. Vietnam's introduction of diagnostic tools in hospitals reduced antibiotic use by 35%, demonstrating this approach's effectiveness. Third, public education campaigns. A key focus should be public awareness campaigns to educate healthcare professionals, farmers, and the general public on the dangers of antibiotic misuse. In Thailand, such campaigns have helped significantly reduce the overuse of antibiotics in farming.
Now, let's turn to international and regional cooperation. Dennis, why is it essential for countries to work together to combat AMR?
AMR is a global issue that transcends borders. We recognize there's critical roles the international organizations play. For example, the World Health Organization has a list of those antimicrobials most important for human medicine. The World Organization for Animal Health has a list of those antimicrobials most important for animal medicine. Also, they have a very good risk analysis model out there for countries to use. Further, the World Organization for Animal Health actually has a monitoring of uses of antibiotics that includes a biomass number, so we can track what's going on globally, think about antimicrobial uses. So collaboratively, Through the information both through the World Health Organization as the World Organization for Animal Health, they provide data that countries can use to look at risk analysis on how to do it, as well as a ranking of importance of antimicrobials. Just one example at the global level of what needs to be done or is being done to advance efforts to address antimicrobial resistance.
And Nathan, how can regional cooperation through ASEAN help improve efforts to combat AMR?
ASEAN can help by setting up a regional AMR action plan similar to the European Union's AMR strategy beyond their adopted declaration and guidelines. This would involve setting up unified standards for antibiotic use, establishing a cross-border AMR surveillance system, and improving data sharing across member states. ASEAN can also facilitate capacity building efforts. For instance, Singapore and Malaysia, which has more advanced healthcare systems, can share their expertise and resources with lower income countries like Laos and Myanmar. The ASEAN region can form a stronger unified response to AMR by working together.
We've discussed the challenges AMR poses, but what about the solutions? Dennis, what innovations are emerging that could help mitigate the crisis?
Today we're seeing several innovative solutions being developed, whether we're looking at human healthcare or animal agriculture. One area is in diagnostics. Ultimately, tools that allow us to more quickly determine infection. Is it bacterial or viral? If it's bacterial, we look at antibiotic. If it's viral, we look at other therapeutic approaches. Also in agriculture, we're looking at alternative production practices through the use of probiotics, vaccinations, understanding the animal microbiome system. In essence, we're looking at areas that we can do to avoid the need for use of antibiotics. Further in this area, as we think about the poultry sector specifically in the last years, there's been a project called Transform, where we look at antimicrobial stewardship use principles. These antimicrobial use stewardship principles allow us to basically look at practices, avoid the need for use, yet if there is for a need for use, ensure those antibiotics are being used responsibly. This is efforts showing where farmers are being proactive, looking at innovation solutions ideas to address the efforts to avoid the need for use if possible, yet if there is a need for use, ensure antimicrobials are used responsibly.
What role do new antibiotics and alternative therapies play in combating AMR? Are there any breakthroughs on that front, Nathan?
While new antibiotics remain critical in combating AMR, their development has slowed due to high costs and limited investment returns. Fortunately, several alternative therapies are showing promise. Phage therapy, which uses viruses to target bacteria, is being successfully tested in countries like India. Antimicrobial peptides, naturally occurring proteins, are being studied in China and South Korea for their ability to kill resistant bacteria. CRISPR-based therapies are also emerging using gene editing technology to disable bacterial-resistant genes. Besides, probiotics and prebiotics are widely used in healthcare and agriculture to maintain gut health and prevent infections. At the same time, traditional natural products like turmeric and garlic are being explored for their antimicrobial properties. Together, these alternatives and new antibiotics provide multiple strategies to address AMR.
Today's discussion has highlighted the urgent need for a multifaceted approach to tackling antimicrobial resistance, from strengthening healthcare systems and regulating antibiotics in agriculture to fostering international cooperation. The September 26th UN high-level meeting underscored that immediate action is necessary to prevent a future where common infections become untreatable. Governments, healthcare providers, farmers, and the public all have roles to play, and through collective action, we can stem the tide of AMR. Thank you for joining us today on Asiaverse, and thank you to our two experts for joining this interesting podcast. Be informed, and let's work together to tackle this global and regional health challenge. Stay tuned to our Asiaverse podcast to stay abreast of developments and their policy implications to Asia. This is Deepa Shri, your host, signing off. Until our next time.